Welcome, everyone. Today we're going to talk about the state of Johns Hopkins Medicine 2020. I'm Paul Rothman, the Dean of the Medical Faculty and CEO of Johns Hopkins Medicine.
I'm Kevin Sowers, the President of Johns Hopkins Health System and Executive Vice President of Johns Hopkins Medicine.
This has been an extraordinary and difficult year, and I want to begin by thanking all of you for your sacrifice and bravery during the pandemic.
By all historical measures, Johns Hopkins Medicine and its people should be proud.
On December 31st, 2019, China reported a cluster of cases of pneumonia of unknown cause in Wuhan City.
When we began working in incident command here, we were doing very, very long stretches. We would do 9 days on, 1 day off.
There's a lot of anxiety, fear, and exhaustion.
In the span of 3 weeks, we've had to stand up an enormous call center here, receiving over 400 calls from employees, and that's really starting from scratch.
In early March, engineers began retrofitting hospitals across the health system. In East Baltimore, creating 26 biocontainment units capable of caring for over 400 patients.
I am up Zayed 3 right now. We've been working 14 to 16 hours a day, doing the best we can to provide a safe environment for patients and for nurses and doctors who are caring for those patients.
On March 11th, the World Health Organization declared COVID-19 a global pandemic. And on the same day, Johns Hopkins set up its first testing tent to administer a test designed in-house.
So this is a molecular assay. It's a real-time PCR. It took us about 3 days. We started going live this Wednesday.
Anticipating the surge, field hospitals were built across the health system, and researchers began innovating solutions to the pandemic's most urgent problems.
This robot allows us to control the settings on the ventilator from outside the room.
So the splitter itself allows the ventilator to ventilate multiple patients.
We adapted existing technologies and developed new ones, like portable ultrasound machines, phone apps for self-screening, lab density control, and Spanish language resources, new methods to produce dialysis fluid, and new ways to connect isolated patients with their loved ones.
Beverly, this is Barbara. You probably have over 1,000 people praying for you right now.
When we go through here, now we're entering the COVID unit. We trained all of our progressive care unit nurses to be able to take care of ventilated patients.
In my entire career, I've never been in a situation that we truly had to triage care and decide who gets care and who doesn't get care.
We got your notice that you sent in, Mr. Stevens, and
oh, good.
I think you underestimated the number of people who took care of you by a factor of 10.
Oh, really?
It really is. It's just an amazing team effort.
You know, we all talk about in nursing and healthcare that we need to stick to our scope of practice. But at this point, I mean, I've been an electrician, I have been EVS, nutrition, stock, everything, just because the need is there and you just have to do what you have to do.
It is okay not to be okay. We are resilient, like the bamboo trees in the wind. You know, we can blow at the wind, but we stand right back again. I know this.
That's the first thing I reach for now. Instead of keys, phone, wallet, more so do I have my mask.
Wearing a mask means life. It means living, and I want to live.
What keeps us going is these people. You show up and you look around and you're like, I've got a team of amazing people going to work with me tonight. They're going to have my back and we're going to get it done and it's going to be great.
So it's definitely been challenging, but I'll tell you, the team has been incredible. Be proud of what you do every day.
And while the summer saw cases fall, the deaths of George Floyd and so many others kept the pressure high. And by fall, COVID was on the rise again. But researchers continued to forge ahead, with more than 200 COVID-19 research studies ongoing.
To see everyone come together to work incredibly hard to help people was very heartwarming. And I think it really represents some of what we do best at Hopkins, which is getting together and collaborating as a group to solve some of our patients' most difficult problems.
Whatever comes next, we'll be ready. It's what we've always done, and what we do. We'll stand tall and face it. And together, we will overcome. I feel like I'm standing on the beach waiting for the tsunami to hit, and
All I want to do is make sure we have all the tools we need to support our patients and our staff. Let's work together. We are harmonized. We are resilient. We are one.
Working as one JHM is a part of our strategic priority. And if there was ever a time that I think we could do a check plus in that category, the time is now, because this pandemic has really forced us to act like one JHM.
You have to think about just the sacrifice and bravery of everyone here. Frontline nurses, respiratory therapists, environmental service people, security people, house staff, physicians, students, everyone worked together. People stayed in hotels, separated from their families, and have done so just because it's what we do. We take care of sick people when they need us.
People came together in a very meaningful and powerful way, and we're going to have to continue to do that. But in doing that, I want to make sure we take care of each other also.
I come out here every day, and I'm actually in the middle of it. Like, I'm close to COVID-19 patients, and I have a 2-year-old. So really, at first I was like, well, maybe I'm gonna take it home to her. But if I keep doing the things that I'm supposed to do so she won't get it, then it don't scare me. I pray daily, and I make sure I keep my area and myself sanitized properly.
We began planning for PPE in January, prior to it actually hitting the US. We watched what was happening in China and realized the PPE was going to be a significant part of the supplies that we needed to respond. And so my hat's off to Dr. Lisa Ishii, Burton Fuller, and the entire supply chain team, because they did incredible work of staying ahead of that.
We came up with the idea of creating PPE fanny packs. Under Armour, who's a great collaborator and partner with us, was kind enough to donate those to us. It was an easy way for our employees to have their PPE and their supplies with them at all times. We have to keep doing what we're doing in terms of protecting ourselves and our patients. So that's all the personal protective equipment, the physical distancing, the keeping the masks over the face and mouth, washing your hands, all those things, and don't come to work if you're sick. It's hard. We've been doing this a long time. None of us want to keep being isolated, but you have to keep yourselves, your family, and our patients safe.
So my name's James. I'm one of the senior general surgery residents, and I was redeployed to the COVID ICU over the last month. Now transitioning back to doing some trauma and acute care general surgery, and had to shift our schedules onto 4 days, 4 nights, and then 4 days off to make sure we all keep up our levels of energy. And we've all been very proud to be able to help out during this time.
You begin with the frontline house staff and fellows, and again, one of the things I like to do is thank them. They were on the front lines with nurses and physicians taking care of these patients, sacrificing, working long hours, putting themselves on the front line and risking getting the disease themselves. And so you have to begin by real thanks for the fellows and house staff who've just worked tremendously hard and sacrificed to take care of these patients. And med students, certainly initially on, we took them off the wards, as did every med school in the country, just because we thought we were short of PPE at the time, to be honest, and we wanted to preserve for the house staff, for physicians and nurses and other staff taking care of these patients, respiratory therapists, and we thought they needed it. As we were able to get more personal protective equipment, we brought the students back, the students doing clinical rotation, so the 3rd and 4th year students, we brought them back in June and then July, and they're still on the wards doing their rotations. In the fall, what we did was we had a hybrid model of teaching, so things that could be done online are being done online. And the key thing that I tell everyone is our number one goal here is to keep everyone safe. And so we're very careful in making sure people have the PPE they need, to make sure we de-densify the labs, and we're very strict on the amount of space per person in the labs, and that we think helps protect the medical students and graduate students as they come back to campus.
And what I'll say is that I hope that what endures from this are the relationships that we forged with each other between our health systems, where we've worked in such incredible and new ways and the relationship we have with the city to be here doing this work, and also with the state and all of our emergency management folks. That, I think, is what will last.
One of the great things about Johns Hopkins is its collaborative atmosphere. I mean, all people work together. And, you know, when you think about this pandemic, it really has taken a team effort.
We developed a governance model where it was University of Maryland, Hopkins, Care First, city leadership, and then state leadership. And in that governing board, we oversaw everything from call centers that were established. University of Maryland and Hopkins set up the convention center together. It's a 250-bed field hospital for the second surge. We were more powerful by coming together than trying to do it by ourselves.
We have a lot of people who've spending a great deal of effort doing research, and there are a lot of components of that. We've been part of many of the large clinical trials trying therapeutics, and that could be, we're part of the trials of things, antivirals like remdesivir. We've been part of other types of just clinically trials, the anti-IL-6 drugs. We also, in addition to doing these therapeutic type trials, are doing a lot of things to understand why people get sick.
Our School of Engineering and several incredible people stood up our website that counts cases not just in the United States but around the world. Has become a national and global resource.
People can get factual data about really where we are in the pandemic. Here in Johns Hopkins Medicine, a lot of people have been out there on the front lines educating people about its hygiene, its vaccines. And this has been a collaborative effort between our school, the School of Public Health, Applied Physics Lab, School of Engineering, School of Nursing. It's everyone trying to work together to try to see what we can do to help these patients. And finally, I think the research we're now doing is moving to the outpatient setting. What can we do, especially for people, the quote-unquote long-termers who had the virus and have these lasting symptoms, and what we can do to help them. So we have just a variety of different lines of research that we're performing on the virus and people with the COVID-19 disease.
I'm a facilitator for the Testimonios, which is a program that is a support group for mental wellness for the Latino, Spanish-speaking Latino community here in Baltimore. One of the things that's so wonderful about it is it gives people a chance to talk about their fears, share ideas. We had people who are in quarantine with COVID and they were able to join the Zoom meeting, which was wonderful because otherwise they were very lonely and scared. So it was a life-saving thing, I believe.
Our staff have done incredible things in our community. So I'll give you a couple for instances. When we started seeing the outbreaks in the nursing homes, we had people who went into a nursing home, tested all the patients, tested all the staff. Our infection control folks went and demonstrated how to appropriately use PPE for those patients that tested positive who didn't need a higher level of care.
COVID-19 has disproportionately affected our Latinx and African American communities here in Baltimore, the state of Maryland, and across the country. This has been very hard on these populations, and we're trying to do the best we can to get them what they need.
We have now partnered with BUILD and the Catholic Church to really get that population in to be able to appropriately educate them on how to quarantine and protect others. In collaboration with the University of Maryland, we're staffing the Lord Baltimore, and that's a place that we have for people who may not have the resources to quarantine themselves and need to be quarantined. I think years from now, we'll look back on this moment in history and realize that the collaboration that has taken place was critical for our success in caring for the citizens of Maryland.
My team is engaged in understanding the evolution of SARS-CoV-2, the virus that causes COVID-19, so that we can understand how it causes disease, how it resolves, why it doesn't in some people, and projects like this are happening all across this campus because of the resources available, the generous patients who give us specimens, and the collaborative nature of this institution.
To be able to quickly diagnose patients with COVID is really important for several reasons, one of which the patient can be isolated away from others, and also we can understand if they have the disease and start to think about whether or not they're going to get sick and what treatments we can initiate early on in their disease to maybe keep them well. Right now we're doing upwards of 2,000 tests a day, and we're headed to being able to do about 2,600 tests a day. The tried and true test is an RT-PCR test, getting samples from the nasopharynx. We now run 9 different platforms to ensure we can do that test on a given day. The reason we need so many is the supply chains of the reagents to run those tests are insecure. We don't know, haven't known during most of the pandemic whether we'll have supplies for some of these different platforms. So the group there, who's been terrific, have been validated 9 different platforms that we can run, and on any given day we'll run some combination thereof to make sure that we can do the tests we need. We've been working with the university about further increasing our capacity for testing. The reason that's so important is that the university wants to bring back undergrads. You have to test them twice a week to keep control. They're in dorms, they're in cohort housing, you need to do that. We'll need about 4,000 tests a day, and we're gearing up to have that capacity. So if we can bring the undergrads back for the spring semester, we'll be able to do that. To do that, we'll probably do, rather than the nasopharynx, it's still an RT-PCR test for the viral RNA, but it'll be using saliva. We're going to get through this. You know, this is a viral disease. We know how to take care of viral diseases. It just takes a while. You know, so far we've had 2 vaccines that have demonstrated extraordinary efficacy in the phase 3 trials in the US. One has been 94%, the other one has been 95% efficacious, and we think that's terrific. If you think about the speed of both getting these therapeutics and these vaccines are at a pace unprecedented in history.
People are right now either walking into something really stressful or just came out of something really stressful. So just remembering that we're doing this together and to just be kind and compassionate to one another.
This is hard. The fact that we're all at risk and we put ourselves out there, to the fact that we're isolated. I mean, we've de-densified. A lot of people are working from home. It's new, it's different. We're on Zoom all day. We're not seeing people. We're social creatures. We miss the interaction, and we're scared. We've had social unrest. We've had the deaths of African Americans in police custody, and that's put a strain on a lot of people. And then we've had a turbulent election that was another big stressor on people.
And at the same time, with the economic impact that we saw in this country, many of our employees struggled putting food on the table, paying rent. And so we had a grateful donor who gave us money to start what's called the EASE program, where people can get financial assistance who need it. The RISE team, I can't say enough about the RISE team that goes out and checks on our employees, especially after devastating events on the unit.
We have a lot of resources from the Office of Wellbeing and others that if people need help, we want them to avail themselves of the resources that we've made available to them to get the help they need.
I can say that I've looked at our employee health plan, and we've seen about a 26% increase in mental health admissions. And by the way, to those folks who've done that, my hat's off to you. Thank you for acknowledging that you needed some help getting through this.
We're here for you, and people who need us, we just want to know that just come and talk to someone. If you really need help, we want to get you help.
This is the entryway to the unit. Often a reminder, this wall didn't exist before COVID. This was an awesome view of the city from the 10th floor.
When I'm in the hospital, there's a really intense energy with people pushing so hard to make sure that we're prepared during this kind of once-in-a-lifetime crisis.
This pandemic has been the most anxious, the most stressful for staff and working that I find.
I am concerned because of the environment that I'm going into, because I have a husband at home with asthma and then I have a child with special needs.
There's a lot of death and sadness around us, but because of the team and the way we've handled it, it's been one of the best experiences of my life.
The motto I've come up with is upright and in the fight. We literally are all in this together, and maintaining that positive spirit is what's going to help get through these days.
Just truly grateful for everything that Johns Hopkins Home Care has done and implemented to take care of us.
We have nurses that are knitting hats or masks. We're helping each other. We're like each other's therapy, and that's just been so impressive.
We have a new program in the hospital where people are just leaving sticky notes with positive affirmations on them.
I've started a peer support groups, and I've also really benefited from the daily mindfulness by Dr. Gould.
These are 30-minute sessions where people can tune in virtually and learn how to incorporate mindfulness practices into their day and get a little bit of a retreat from the stresses of the day.
During this time of the pandemic, we've had more than 20,000 employees click on our mindfulness and our yoga and our emotional intelligence resources.
They came out and did a parade for us, came in their cars, waved with big posters, so it was so exciting and so really neat to be a part of that.
It's going to take a while for us to recover from this, but the best thing is that we learn and we use those projects and those creative, innovative ideas and bring them forward to change healthcare.
One feeling that is alive and well at the moment is this sense of camaraderie. Everyone feels that we're all in this together, and I believe strongly it is that feeling that will get us through this.
Whether we're in a pandemic or we're not in a pandemic, I signed up to care and to serve at all costs.
You do it because it's you. It's your gift. I think you get satisfaction and meaning in what you do.
We're going to get through this together because we are in this together, and that's the bottom line.
And I want to make sure we have a healthy workforce on the back end of this, so we need to take care of each other and really support each other through this unprecedented time in our history.
I've been always proud to be in this position, but during this pandemic, I'm so proud of the institution. We've been leaders. We are a family here together. We'll get through this together. We think coming out of this, we're going to have great opportunities. We're going to get through this, and then we're going to just grow, we think, in an unprecedented way after the pandemic's over.